Welcome to my project in AI in healthcare. When I was researching, I read about an interesting story. According to a recent Wire article, Harry, a college student, received an email that included his name, social security, and the name of the clinic where he was treated as a teenager. Vastaamo was known in Finland to be one of the most private mental health care facilities that exposed many patient records. As a result, the actor demanded bitcoins for patient records, which costed about 200 euros, or roughly about $231. Some existing policies. 3. Breach notification rule expectations from the United States Department of Health and Human Services by using protected health information PHI. The first expectation is having unintentional mistakes, acquisitions, or the use of PHI was made in good faith and within a person's authority. Accidental disclosure on PHI between authorized individuals within the same organizational or arrangement. Disclosure if the recipient could not reasonably keep the information disclosed. Similar existing policies, the European Union aims to build public trust and enhances clinical practice throughout the implementation of AI. This can be similar to United States policies where it was looked to improve public trust and improving clinical safety services. Proposed AI using in a healthcare setting. Some of the responsible parties, as I mentioned, are JACO. They need to help deliver guidance in the healthcare organization for self-governing. Hospitals like Johns Hopkins University is now offering for many of their workers AI training to improve their staff knowledge about AI and having a proper mission statement and goals for the future, and also AI vendors. This means the AI vendors have to find a way to improve their coding skills and train in AI to be able to find more accurate sources by algorithm. We've seen as AI has been changing in the world, we need to make sure people are in consent in order to use it and keep data safe. This means typically healthcare breach costs about in the United States about $7.42 million, which can be very severe. About 59.5% do not have any prior experience with AI tools. About 725 data breaches were reported to the Office of Civil Rights, and across these breaches, more than 133 million records were exposed or impartially disclosed. According to Future Capital, as the supporting evidence, approximately 33% of the professionals are expressing concerns in the healthcare field about the implications of AI. In the year of 2023, the IBM article said roughly 4.45 million increased about 15% of the average cost on data breach, according to Pew Research in 2023. Mentions that about 33% individuals believe that AI in health and medicine, the outcome will be worsened. While I was researching, I was very curious about Illinois, since that's where we all live. Looking at the HS website, there are about 36 cases under investigations in Illinois over the last 2 years. One of them we know as the company as Walgreens. So even our local drugstores are not even safe from breaches. Another one that was impacted was Blue Cross Blue Shield. Majority of us have that insurance. This was about almost 20% of the investigated cases came from this very popular insurance company. Some outlook recommendations, I would say we need to expect greater patient coverage, trust, and satisfaction by enhancing patients' information, providing stronger data security, or establishing a framework for ethical adoption of AI into medicines. Policymakers need to be making and developing a standard AI disclosure agreement between policymakers and patients, providing regular feedback to the public, encouraging JACO, and collaborating with the United States Department of States. Some consequences of inaction might be that patients continue to mistrust patients and the AI systems. A lack of ethical and regulatory guidance will lead to hospital and patient exploitation and ultimately increase in breach occurrences. Financial and legal consequences like copyright associations or data breach may happen again, so thus the hospitals will lose opportunities to advance in AI integration. And these are my references. I hope you guys enjoyed my presentation.